Hi, my name is Amanda Spitkowski, and I am a DNP student at East Carolina University. Today I'm going to talk about Health Information Exchange, or HIE. Health Information Exchange, or HIE, allows medical professionals and patients access to view and share patient health records electronically. Health information technology can improve medical care in various ways. It can prevent or decrease duplicate tests. It can decrease or avoid medication errors. It can avoid admission or readmission to the hospital, and it can allow various providers to be on the same page regarding patient care. There are three forms of health information exchange. The first is directed exchange. This allows one provider to send another provider information on the patient, such as test results, updated medication list, and notes. The next form is the query-based exchange. This form is used by providers to search for and access patient records. It can be used in emergency situations when a patient is being seen in the emergency room, or when a patient goes to their primary care provider and has been recently seen by another provider and is unsure of what was said or changed. The final form is mediated exchange. In this form, the patient has access to their records. They can update and correct billing and health information, provide their providers with their health information, and track and monitor their own health. The Health Information Technology for Economic and Clinical Health Act, or HITECH Act, was enacted in 2009 and is part of the American Recovery and Reinvestment Act, or the Stimulus Law. The focus of health information technology to lawmakers was twofold. This was a way to stimulate the economy and a way to improve the delivery of health care. The HITECH Act is part of the Title 13 in Division A and Title 4 in Division B of the American Recovery and Reinvestment Act. Title 13 discusses the development, adoption, and implementation of health information technologies, policy, and standards, as well as patient privacy and security protection. Title 4 in Division B of the American Recovery and Reinvestment Act discusses Medicare and Medicaid health information technology and the financial incentives for healthcare professionals and hospitals that utilize electronic health records technology. In 2009, when the HITECH Act was enacted, it was estimated that less than 8% of hospitals used a basic electronic health record system. In 2015, the Office of the National Coordinator for Health Information Technology estimated that 3 out of 4 hospitals have a basic electronic health record system, and that 97% of large hospitals have technology certified by the U.S. Department of Health and Human Services. The HITECH Act has two committees, the Policy Committee and the Standards Committee. The Policy Committee makes recommendations about how to implement the HITECH Act requirements, and the Standards Committee recommends the standards that the health information technology is to be electronically exchanged under. One barrier to the HITECH Act is security. The U.S. Department of Health and Human Services is required by the HITECH Act to provide annual guidance to healthcare providers to secure health information. There are 4 types of security breaches: unintentional, intentional, outside attacks, and network issues. Unintentional breaches include unsecured terminals, loss of devices, and unsecured passwords. Intentional breaches include malicious insiders, social media use, and unauthorized access. Outside attacks include hackers, viruses, spam, and theft, and network issues include unencrypted transmission and firewall failures. North Carolina's General Assembly has created the North Carolina Health Information Exchange Authority, or NCHIEA. The North Carolina HIEA oversees and administers the state-designated Health Information Exchange. The Health Information Exchange in North Carolina is called NC Health Connects and is a secure electronic network that facilitates conversation between healthcare providers, allowing them to access and share health-related information across the state. North Carolina Health Connects is managed by NCHIEA, which is housed within the North Carolina Department of Information Technology. Healthcare providers who receive state funds, such as Medicaid, must connect to North Carolina Health Connects by specific dates in 2019 in order to continue to receive payments for services provided. All hospitals, physicians, physician assistants, and nurse practitioners who provide Medicaid services and who have an electronic health record system must connect by June 1, 2018. All other providers of Medicaid and state-funded services must connect by June 1, 2019. Local management entities and managed care organizations are required to submit encounter and claims data by June 1, 2020. Providers who do not receive state funding have the option to connect to NCHIEA but are not required. Patient information that can be accessed on North Carolina Health Connects includes allergies, encounters, immunizations, medications, problems, procedures, and results. Information on Health Connects can only be accessed by providers that fully participate in Health Connects. One recommendation to advance the implementation of health information exchange in North Carolina is to design a Medicare app that can track patients' chronic diseases, medications, and all healthcare providers involved in patient care. This user-friendly app can be pulled up on the patient's cell phone at each provider visit and can be updated with any changes after the visit. A second recommendation is an electronic health record system that links diseases with up-to-date, evidence-based recommendations, treatment plans, and medication plans. This will benefit the providers by decreasing time spent researching appropriate treatment and medication regimens, and will benefit the patient by providing the most current updated treatment options. With most patients having more than one provider due to the increase in referrals to specialists, health information exchange technology is a novel way to keep all providers informed of additions or changes to patient care. I hope this helped understand health information technology and exchange a little bit better. Thank you.